this way we can have it posted and shared for people to view. So as I said, my name is Eric Robinson. I'm the Scholarly Communications Librarian. I'm hoping that this Lit Search Like a Librarian webinar will build on skills that you already have, either through your basic evidence-based practice coursework and database searching, but hopefully give you a little bit deeper perspective on library searching and the resources that the library has, and how you can delve into those a little more successfully. So this particular webinar is one of my favorites because it is not heavily slide oriented, so there's not a lot of PowerPoint here. I'm going to dive straight into the library website, and we'll kind of build from there. I will say we've got a fairly small group here, so if anyone wants to unmute themselves at any point and interrupt me with a question, if it's relevant to what we're talking about, please feel free. Do keep yourselves muted. Sounds like there's some pretty hectic stuff going in the background at least one person's place, so keep yourself muted other than if you want to speak or want to address a question, but do please feel free to interrupt me at any point. Okay, so first of all, I hope everybody's familiar with the Search USA tool, which is from the library homepage. I'm just going to do a quick refresh, quick view of that real quick. So let's say we were doing physical therapy. Let's say pain. So we can do a quick keyword search, make sure we're logged into our account, and view the results from Search USA. That's the search box on the library homepage. When you do a search there, you're essentially searching a large number of databases. You'll see here where it says Search USA, there's multiple databases and sources. I'll show you something in a minute that tells you exactly what those sources are. But I want to point out that while Search USA does search lots of different sources, lots of different databases, it doesn't search absolutely everything that we have available through the library. Notable exceptions are anything from the ProQuest database. You'll notice that you'll see the My EBSCO host indicator up here. There are a number of databases produced by a company called EBSCO, and they tend not to play well with other companies. So while EBSCO and the Search USA tool will search lots of different databases, they tend not to include their business competitors. So ProQuest would be excluded. You might want to do a separate search in ProQuest or find some other way to make sure that you're doing a thorough search of the literature if you're doing that. I'm hoping that when I start talking about these limiters, that is these sort of filters along the left side of the screen here, that's all fairly familiar to folks, but we'll be elaborating on that a little bit. Just briefly summarized for people who might be brand new to this stuff, once you have performed a search in any one of these databases, there's usually a number of refinement criteria, typically located on the left-hand margin here. And you can scroll down and you can limit them by language, by date of publication, by document type, and it's a quick way to drill down to what you might be interested in specifically. One thing that's very common is you might want to limit your results to peer-reviewed research. So there's just a simple checkbox there, and you'll see that updates our results to filter out only the peer-reviewed items. For my search here, we've still got some 406,000 results because I have a very vague search up here. But these limiters can be very useful when you're trying to drill down to a reasonable amount. I did mention that Search USA also includes searching of numerous databases and numerous sort of indexing sources. And you can see what those are here under Content Provider. So this functions just like the other filters that we mentioned, but you can see the various databases that are included here. And there are a lot. So you can see this full list, everything from CINAHL, which is a nursing item, to an academic general one. Gale Health and Medicine is specific to health and medicine, obviously. Medline is similar to PubMed. They're both produced by the National Library of Medicine, but PubMed includes a little bit looser inclusion of material. Medline is very strictly scholarly, peer-reviewed research. So you can limit your results to any one of these indexes or databases, they're sometimes called, and anything that you're doing in Search USA, you can filter that to, let's say, only include information from Medline and CINAHL. You might have different reasons to include others, but let's just do a quick demonstration of that. Once I update my results, we had some 400,000, but if I limit it to these two databases, that cuts it a little more than in half. So it went from 400,000 to 168,000. Still an awful lot. You're probably not going to read 168,000 articles, at least not this year. But knowing that you can limit that by those databases is one way to use Search USA a little more effectively. On that note, I want to mention that most of these databases, let's go back to my subject list here, or my content provider list here. Most of these databases have some sort of topic specialization, right? So CINAHL is a nursing database. So anything covered in CINAHL is going to be nursing, nursing focused, have some nursing angle on. We have other health and wellness, health and medicine items. We have psychological information. We have specifically rehabilitation information in, let's see, where did it go? There we go, sport discus, that's the one that I was looking for. So that's PT and sports medicine. So when one very simple thing you can do to improve the sort of relevance of the research of the academic literature results you're getting in your searches is to select a database that is topically focused on what you're interested in. So you can see, the 400,000 items that we had here, that includes things from like general science databases, systematic reviews, business databases. So if we kind of exclude from our search the less relevant indexes, let's say we're looking for physical therapy in pain management, we have no interest in any of the things that are going to be returned from the social sciences or business indexes. So you can select the database that you're searching by topic, and that will keep your results from being crowded with potentially completely irrelevant items. Any one of these indexes, any one of these subject-specific indexes is only going to include information on that topic. So I don't know why I like this example so much, but if I were just searching for pain, I'm going to get very different results if I'm searching in a nursing or a clinical science database than if I'm including, let's say, arts and literature, right? We're going to get a lot of junk that's not necessarily relevant, from the depiction of pain in Western art to, who knows, emo poetry from the 19th century. They're very different definition of pain, right? Or at least in terms of our clinical application. So selecting a database either through the Search USA content provider limitations that we have here, or just going directly into that database and searching is going to remove a lot of those less relevant results. Okay, so another way to look at the same idea of selecting a subject database from the library homepage, if you choose resources and databases, you can go in here and you'll see that we have all of the indexing and database resources that we have access to through the USA Library, divided by subject. So we've got education databases, we've got business databases, medicine, nursing, psychology. So depending on the topic that you're searching, choosing one of these databases is going to really help focus your results. Okay. I want to take a close look at PubMed and a little bit more detailed information within PubMed. So PubMed is one of these subject-specific databases. This is from the National Library of Medicine. In order to provide a very focused coverage of biotechnology, biomedical, and clinical science information, PubMed and the National Library of Medicine screen all the academic journals out there. They go through them and they decide, these 50,000 journal titles meet our criteria for inclusion in this index. So they're not including the Journal of Western Literature. They're not including necessarily strictly psychological literature, unless it has some clinical or biomedical application. So we can really change the results that we're getting in that regard. So let's just say I go in and do the same search I did in Search USA, physical therapy and pain, which is quite a vague search, right? I could certainly focus that to low back pain or something, but you can see I'm only getting some 60,000 results, even with a very, very vague set of keywords here. Okay, compared to the 400,000 that I initially got using Search USA, because that's bringing in things across lots of different databases that may or may not be relevant to the particular biomedical clinical research that I'm interested in. Okay, again, you'll see here in PubMed limiters down the left-hand side that allow you to filter for the publication year, whether or not the full text is available, how recently it was published. One that I really like to point out to folks is that you can select filter for language. So I teach this anytime I expose folks to the databases, because on our interlibrary loan side of things, we're happy to provide you with any article that you can't initially access directly through the library resources or online. We can request through interlibrary loan, and that's free. There's no charge to you for us to do that. But the one thing I want to point out is we regularly get requests for articles in Mandarin Chinese or German or Turkish or something like that. And I always double check, it's quite possible that our students are multilingual, and some of them are, but some of the more obscure languages, Mongolian or something, I always want to double check and make sure that you're interested in the article published in Hungarian. Do you read Hungarian before I actually request that? But if you're doing your search, you can choose the languages that you're able to return results in. So you can make sure that it's not giving you the articles in Czech if you don't read Czech or Finnish or whatever. So you can select English. Let's say I speak reasonable German and reasonable Portuguese. So I could limit that to those and shave off any of those less relevant results. See, it doesn't change my numbers much, because much of Western medicine, English is really the kind of lingua franca for sharing that information. But this guarantees that I'm not accidentally stumbling across an article in a language that I don't speak and trying to locate that and then being disappointed when it comes and it's in Finnish and I don't read Finnish. So I just want to make you aware of that. Any questions on kind of the basic functionality of those limiters, either in Search USA or any of the typical databases? I'm hoping that this kind of information is somewhat basic to folks, or at least it's not the first time that you're seeing it. But I do want to take a second and see if anybody has any comments or questions there. And again, feel free to interrupt me at any point if you want to ask a question, or don't necessarily have to wait until I ask for questions. But okay, So from there, I'm going to move on to another thing that I think is a really useful skill, piece of knowledge, however you might want to describe it, for really, again, getting more effective results in your literature searching. And that has to do with what we call controlled vocabulary, or subject headings, or subject indexing. And the best way that I can think of to describe that is, if I'm reading a book and I flip to the back of the book and I have an index, right? Any one of these indexed articles is going to have a set of subject headings associated with it. You may be familiar with author-assigned keywords. Certainly, in instances where there's an abstract, a lot of that information can be useful. But we've also got these subject headings, which are specific to the database that you're using. So this happens to be, where did it go? Sorry, we're looking at a CINAHL record here. So the subject headings are specific to the CINAHL database. But these can be very useful because we might want to distinguish between kind of vague uses of a word. A simple example would be, if I were reading a book about pets, and as I go through that book, cats might be referred to as cats or felines, or whatever synonym you might want to use for cats. But if I want to find all the references to cats through that book and I flip to the index, there's probably one term. Like if I look up kittens, it's probably going to say sea felines or something like that. And this is sort of your speaking of felines, cat clawing back there, sorry about that. So this is similar to that indexing term, right? So physical therapy is a very common one. I think a quick distinction between physical therapy as a profession, physical therapy as that profession that you practice when you go into clinical practice, versus what are often called physical therapy modalities, so the various treatment methods. You can see that physical therapy might be used in different ways. And if I'm looking for articles on physical therapy, if I don't distinguish physical therapy versus physical therapy methods or modalities, then I might get a ton of articles on the business of physical therapy or physical therapy professional practice, not necessarily on the clinical performance and treatment methods that I might be interested in. So utilizing these subject headings are a great way to kind of help focus that information. And most of these databases are organized in a way that if you're looking at a single record, you can scroll down and click on these linked indexing terms and get a set of results that utilize that specific term. So you can see here at the top, I've gone and clicked that combined modality therapy, and it's taken that phrase and put an MM in front of it. And I don't want to concern ourselves with the technical format of that, but what that's saying is that it's not just looking for the keywords occurring anywhere in the article or anywhere in the record that say combined modality therapy. It's only looking for where those appear as subject headings, right? These controlled subjects that we were talking about. So that way, you're very specifically searching how the index has treated, or that database has treated, those particular subjects, and you're narrowing to those specific uses defined by the database and not just a keyword. So just to contrast that, with that subject heading and that phrase, we've got some 7,000 results, right? If I were to cut out those keywords and do the same search where I'm not specifying that I'm looking at those subject headings specifically, that was the MM and the quotation marks, I can just search for that set of keywords, and instead of 7,000 results, I get back to something like 400,000, right? So so utilizing those in your search terms is a good way to really laser focus your keywords. Another way to do that is, we already saw when it labeled the MM, and that was to put items in quotation marks. This is very useful where you have kind of common terms, like therapy itself might be, occur in millions of articles, but we're interested in it in specifically this phrase, combined modality therapy, right? So what this does is, instead of looking throughout the article, throughout the record for these three words appearing, we're looking for them to appear together as a phrase, right? So instead of just hitting on every article that includes the word combined, the word modality, and the word therapy, we're only returning those that include that specific phrase. And if we do that, we go from the 400,000 as a keyword to cutting that in half as a phrase. And then back to what we did before, where it was searching for the controlled subject heading in CINAHL. Then when we do that one, we're back to the 7,000. So that phrase searching and subject searching are ways that you can really, really focus those things. Now, when it comes to the subject searching, one way that you can utilize that is to look in a given record and see what's there and just click on that. But you can also grab any one of these subject terms and add that to your string of search terms, right? So we were looking, I think initially we were looking at pain and physical therapy, but I can grab that subject term, care and treatment, and go back into my search here. I can grab that. I can grab care and treatment and either just put those keywords in or treat it as a phrase, and combine that with my initial search, which was physical therapy and pain. And I can just sort of rotate that into my substitution of phrases that I'm searching in conjunction, right? So we got now instead of just physical therapy and pain, we've got physical therapy, pain, and the phrase care and treatment. Okay. Another way that you can utilize those subject terms is using the advanced search. So advanced searching, the kind of main aspect of this is you're setting up a specific field. By fields, I mean the various elements of the record, right? There's the author element, there's the title element, there's the abstract element, there might even be the journal title, and you can search each one of those particular structures for keywords. So let's say we're interested in pain and physical therapy. I can change up my example to some nursing examples if you like, since I'm sure not everyone here is a physical therapist. Spell things correctly. That's another thing. Always make sure that you're spelling your searches correctly. But I can limit that instead of just everything in the record. Maybe I'm specifically interested in ones where that's included in the title of the article. You can see how an article might mention pain versus being about pain, right? And if it's about pain, it's probably going to be in the title. And so again, just by limiting that search to the title, we went from our 400,000 results to some 400,000 or to some 4,000. And then of course I can bring in all of my limiters over here. I can add additional combinations to that search. And the more specific I'm being, the more narrow I'm focusing my results, right? The more words I add to the search string, the greater requirements I'm putting on anything that comes back in my results. So at some point, I could add word after word after word up here, being more and more specific. And at some point, I'm going to be so specific that nothing matches my results. And I think that's something that folks tend to run into very often, particularly at new scholars, kind of just getting comfortable with their PICO questions and things like that. So they might be like, I am interested in physical therapy modalities for pain in elderly men with lower back pain, and they get overly specific, and boom, they've got no results. So I want to take a break before I go into that section and just double check. I thought I saw some chat activity. Yeah, MM is just a kind of technical tagging way that the database specifies that it's searching the subject headings, Gabriella. So I saw that you had that. Occupational therapy. Okay, we'll do some occupational therapy examples as well. So one of the things that I think is a common problem for folks is they're looking for the article that best reflects the scenario or the research question that they might have. And that is, I'm all for that, right? But at some point, you really want to keep in mind that the more specific you're being, the less results you're going to get. So I'm looking at what I've got here. I'm looking at pain, physical therapy modalities for elderly men and lower back pain, right? So I could probably start cutting out some elements of this. You know, maybe the gender doesn't matter, maybe the age doesn't matter as much, and I can, you know, start sifting things off. And if I'm being overly specific, I recommend removing the words that are that you can kind of look at and say, that's probably not necessarily getting me better results, and it probably is limiting how many items I'm returning, if that makes sense. So anytime you find yourself getting too few results, look at your search string, look at your specifications. Like, we're looking for all that information in the title. So we might want to do more of a keyword search or something. But if you're getting 0 results, or you're getting 3 results, and you're confident that there should be more than 3 articles on the topic that you're interested in, look to how specific you're being, and can you cast a bit broader net, either through removing some narrow specification that you might be putting in play, or a particular field structure, or subject terms, or however you might be increasing the specificity of your search. If you can step that back 1 step or 2 steps and make your search just a little more vague, then you're sort of casting this broader net, and you'll probably get a little bit better results in terms of that. Does that make sense? Okay, so as long as I'm on the subject headings, if there are no questions, I want to pause for just a second for any questions about that. So let's talk about questions on field searching, on combination of search terms. I also talked about using quotation marks to search for the phrase. So things like that. Anybody have any questions about any of that? Was that all clear? Now, any one of these things is a skill that you can kind of work into your rotation as you're substituting and retrying your searches, recombining your search terms. You can start adding things in phrases and see what that does. I always emphasize, particularly again to students who are new to searching the published literature this way, there is rarely a single best search, and you're never going to find it on the first try. So when I teach index searching or database searching, I really try to emphasize that your search isn't a one and done thing. It's a process. You search a particular string of words, you see what those results were, you maybe adapt your string of words, you maybe even read some of the literature. If you're new to a topic, getting a sense of how the literature phrases that particular topic might change how you approach your search. So after you've read an article or two, you might come across something. What was the one I came across through the other day? Muscular recruitment might be a term that you didn't put in your initial search, but after you've read a little bit, that seems to be a good way to capture what you're looking for. So then you might, once you've learned some of that language, start adding that into your search. And also, there may not be one, even after multiple practice, there may not be one single best search. You might get a good chunk of results with one search, but then completely revamp your search and get other results from a different perspective that are also super important. So I think that's best kind of shown by example, right? So I think before I jump back into PubMed, let's talk about an example where different sort of angles in our search might yield two different searches with equally relevant information, right? So we might be interested in cardiac rehabilitation. Most. We're just going to do a general keyword search, so we're not specifying a field here. But we're also interested in patient education, right? So let's say we're setting up an emergency room screening program where we identify patients with cardiac predispositions, and we want to do patient education for that group. So we might start off with a simple cardiac rehabilitation, I think patient education, and emergency I've got in my search here. Now, I might get a good chunk of results here, and looks like I am, but I can kind of go at that. I'm like, okay, that's an awful lot. What if I put patient education instead of doing a keyword? I put that in quotation marks, right? So get rid of that, and we're going to say rehabilitation, emergency, where we're searching for patient education as the phrase. And that really cuts things down a little bit. Now, what I want to point out here is that we are looking at two sort of key topics that come together, and being able to separate those key topics. By key topic, I mean we're talking about cardiac rehabilitation or cardiac disease and patient education, right? Now, I think a lot of people come into this sort of thing for the first time might not think that any old screening program in an emergency room for patient education is going to be, sorry, my I key's not working. There we go. Screening, emergency. So emergency room screening programs that sort of target patient education on whatever topic. It might be stroke, it might be cardiac, it might be fall prevention, but you can see how patient education and screening programs completely with nothing to do with the cardiac aspect might still be useful, right? If you have a really successful screening and patient education program for stroke, that has relevance, right? For our scenario. So what I want to encourage you to think about is how you could break off chunks that present one angle of your research problem that may not include all of your specifications, but would definitely inform your project. So in terms of our scenario, anything on patient education, or at least effective screening and education programs, would be useful. So I might find a stroke article, and I don't want to dismiss that because it's not cardiac rehabilitation. I could easily read that article and find lots of relevant information on the program and the patient education side. So I definitely want to encourage folks to think about how they can break off chunks of their search and find maybe somewhat more tangentially related, but still very, very relevant and very, very informative information for their topic, even if it doesn't map on their topic 100%. Okay. Quick question in the chat while I switch back there. What database is best for qualitative articles, or what database is best for quantitative articles? Well, I wouldn't want to say that a single database is going to give you more of one or more of another. I do understand that that's an important part of some of your coursework, is being able to identify those. What I will say is that familiarizing yourself with the types of research that fall under those kind of super headings is going to be useful. I will point you to a library guide. So from the library's website, we have these research guides, and A to Z, and we do have some in here on qualitative and quantitative research. And I think the best way to, where is that? Finding qualitative and quantitative research. So we do have this research guide in here. I think Ryan Gaylor put this together. And I think the best way to think about your question is, what types of research might be quantitative and what types of research might be qualitative? And can I craft my keyword search to identify that, right? So if I'm searching for randomized clinical trials, that's much more likely to be quantitative than qualitative, right? If I'm searching for phenomenological studies or identified themes or concepts or something like that, that sort of defines qualitative research, patient experience, keywords like that are more likely to be qualitative. You know, phenomenological is talking about your themes and your experience and your concepts, whereas something that's very rigorously quantitative likely has some statistical analysis, likely has some additional data in forms of numbers and statistics and things like that. So that's one way to think about that, is how can I incorporate things into my keywords that will be reflective of those different research types, and that will likely return my results. That's not going to be foolproof. You will very likely get mixed methods studies where you have some qualitative and some quantitative, and most databases are going to include, I won't say equal quantities of each, but they definitely will all include both. And there's not going to be one database that's going to sort of automatically sift those out for you. But familiarizing yourself with the study types, familiarizing yourself with characteristics of those is going to go a long way. This looking for qualitative and quantitative guide here has a few kind of keywords that can help you narrow in on quantitative or qualitative research. Like I said, I mentioned phenomenological research. Interviews or narrative research tends to be focused on concepts and themes that define qualitative research. Ethnographic research often is much more qualitative. Case studies are generally a single case, so they're not necessarily assembling data across a large patient sample. So they tend to be a little more qualitative, although you might have quantitative measurement of a particular function or something like that for that single patient. But those keywords are likely to get you more qualitative research, whereas a pre-test, post-test experiment is going to be very, very numbers and statistic focused. Randomized clinical trials tend to have large sample populations, so they're doing statistical generalization over the sample population. Data distribution, things like keywords like that. If you're searching like full keyword searches may also help identify those. But really the key thing for you, I think, if you're looking for that, is to do a good subject search and then be comfortable enough with what defines those two types of studies that you can look at any article in your results list and say, this one's quantitative, this one's quantitative, this one's qualitative. If you have to find a qualitative article and you're digging and digging, something like this keyword strategy might be useful for you. Does that answer that question well? Okay, good. Let's see. I'm going to go back to my search string. So double check the chat. Good, I'm glad. So that's the quantitative qualitative aspect. We've now talked about using phrase searching and the subject headings specifically. I want to kind of take what I was saying about the subject headings and bring it back into PubMed, because I think PubMed is a very, very useful subject-specific database that almost everyone in our programs is going to be utilizing fairly heavily, and kind of talk about how PubMed does that subject heading for searching. So we can take any one of our articles here. You can see I mentioned physical therapy modalities before. You can see that popping up in our title here. But I can take any one of the articles, just like we did in Search USA or CINAHL, and look more closely at the record for that article. And you can see we've got all of our title and publication information up here. But if it's listed in PubMed, if you scroll down toward the bottom, you'll see MESH terms. And MESH terms stands for medical subject headings. And this is the same kind of controlled indexing term specific to the database that we were talking about before. So another way of being very specific about how the database captures that and how the database indexes that information. So some of these things, we were looking, our general search was physical therapy and pain, right? But if we're looking at these terms, we've got neuralgia, we've got pain management, we've got treatment outcomes. Any one of these might be a better way of formulating the thing that we threw up initially, right? So pain management methods looks like a pretty solid one if we're looking to coach people on how to manage their pain better. So you can incorporate that phrase into your research and your literature search, your keyword combination. I want to zoom in on one of these records really quickly, because PubMed does a good job of having a searchable list of these specific subject terms, and you can view their definition of that subject term very clearly. So we have pain management, it's given a definition, and this is how anybody who's indexing an article in PubMed is going to apply that term. When you're viewing this, you can click on it like I just did from the list of MESH terms in a single article. You can click on that and search in MESH, and it'll give you the definition of how that subject term is used. When you're in PubMed, you can also select MESH from this drop-down heading up here, and then you can search the list of terms. So again, this is searching the list of their index terms, the terms that they use for indexing, not searching articles at this point, because we're looking in MESH, we're not looking in PubMed. So if I were to search PubMed to get articles, I would choose this one. But you can see if I'm just interested in pain and not sure kind of what specific subject term I might want to use, I can just search pain and see all the things that incorporate pain into the subject heading. Maybe I'm interested in chronic pain and not acute pain. Maybe I'm interested in chronic pain and pain management. You can see there's a number of terms here that I might use that would help me more specifically capture what it is that I might be searching. Shoulder pain and back pain, neck pain, some of those things. Maybe when I was searching, I only searched joint pain. But if I look through here, I can capture specific joints, right? I can capture knee pain or lower back pain or whatever that might be. And this is a way for you to see what the best way for you to capture that is. So I could combine my shoulder pain, get a good sense of how that term is being used. And the other thing I want to show you here, like I said, you can use these phrases or these as a keyword back in your search of the literature, or what you can do within the mesh tool on PubMed. So if I select mesh from this drop-down menu, as I'm searching out those individual terms, you'll see this PubMed search builder over here at the side. What that's going to do is create a combination of search terms based on what I've identified through here. So at any point, I've decided, oh, okay, I want to do shoulder pain. I want to add that to my search. And this is going to do a similar phrase search of the mesh terms, like we had the MM in the quote before. Now it's going to search anything in PubMed that has that as a mesh term. And I can continue to build on this search builder by looking up other terms. Let's say we had chronic pain, I think was another one. And I can go in and I can select chronic pain, and I can add that to my search builder. And I think we had pain management. That was an official term, and I can add that to my search builder. So now you see we've got a nice combination of specific indexing terms using mesh or using the local index-specific subject terms, and we've built up a fairly well-combined set of those phrases. And then once I've got that search builder built up the way I want, I can just click search PubMed and plug that straight into a keyword, or the general search that we would be doing with our keywords of PubMed. And it's going to return the ones that have specifically mesh for shoulder pain, chronic pain, and pain management. And you can see we get some 16 results over the last 10 or 15 years that can be quite relevant, quite focused and narrowly focused on the topic that I'm interested in. So when I'm working with students and they give me their kind of general topic, the way that I, as a librarian, am thinking about it is, how can I get the most complete and most specific information on the topic that they're talking about, and sift out all of the irrelevant junk. And one of the ways that you can sift out all of the irrelevant junk is to make sure that you're using these mesh subject headings or the specific database subject headings to really narrow your definition of shoulder pain or chronic pain, using that phrase searching and those specific database terms. Okay, so that's a lot. I do have a couple of other things I want to cover, but I wanted to take a second and open it up to folks who might have some specific questions. I do have a couple of other skills that, if we have time, I'd like to mention, but I do want to have plenty of opportunity, given that we had folks come in, to address any specific questions you might have, or maybe even play around in a search that you've been struggling with. Everybody still here? Just no questions? Give it one more minute in case somebody's punching something into chat. Okay. So I definitely remind folks that that any literature search is a process. You might have one successful search for one aspect of your topic, and a different search that gets at the other aspects. So I always say that literature search is an iterative process, meaning you do it again and again, and hopefully you get better and better results every time you do. You might even go away and read 10 articles and come back and do another search and inform your formulation of the search from what you've gathered from reading the literature. So before I set you guys free, I just want to mention a couple of other kind of not tiny, they can be very useful elements that you can kind of work into your skill set. I'll point you back to the library guides. So we have, I believe, something like advanced searching. If you search the library website for advanced searching, you should get, yes, advanced database searching. So I would highly recommend this guide to folks. It talks about the phrase searching that we talked about, talks about database specific vocabulary, so the specific subject headings for a database. One of the other things that you can do is combining phrases, so specifying and structuring your search. That tends to take a lot of practice, but I just want to give you an idea of what that might look like. So let's say, one second, sorry, I'm trying to switch my screens here. So let's.
Hi.
Yes, you have a question?
We can't see the screen.
Oh, I'm sorry. Sometimes when I switch screens, it drops that off, and so I'm going to go back into just Search USA and reshare. Are you seeing Search USA now?
Yes.
Okay. So let's just start with a simple library, right from the library homepage again. We're going to go straight into Search USA so we can search a number of databases. One thing that you might want to capture is variations of a particular idea, right? So let's say we're doing occupational therapy. Bring it back to our student who requested an occupational and OT example. We're searching for occupational therapy. Spell it right, Eric. Sorry, I'm also struggling with a dysfunctional keyboard here today. So let's say we're looking at stroke patients, and maybe, let's say, hand strength. So we can do that search and get some set of results. But what I want to look at is, let's take the concept of stroke, right? So stroke can be described in different ways, right? It might be ischemia. Sometimes they'll talk about the damaged tissue as being ischemic. What else? Other phrases for stroke? Sometimes you might have like a TIA or something like that, but generally we want to stay away from abbreviations. But what I'm trying to get at here is we can use some structuring. I'm going to go to the advanced search and see if we can get a better view of this. So I've got my occupational therapy. When I get to the stroke part, I can do stroke or ischemia, and you'll see you get some pop-ups here, right? So cerebrovascular accident. You might have transient ischemic event or something like that. But you can roll those essentially synonyms, at least conceptually, for what we're trying to get at here, into a structure. So cerebrovascular or ischemia. And you can see, I know these aren't synonyms per se, but I can roll them into kind of capturing all of those elements. Let's say the article refers to that stroke or that ischemic event in different ways, or different articles might refer to them in different ways. And I can roll all of those into a single search by using like a set that concept off in parentheses and including or. So it's going to include all of my other criteria up here and any one of these things that I've got under or, right? So it's going to have occupational therapy, hand strength, and either stroke or cerebrovascular or ischemia. Okay, so it's a way of kind of doing 3 searches at once. This is the same as me performing a search for occupational therapy, hand strength, and stroke, and a search for occupational therapy, hand strength, and cerebrovascular, and a search for occupational therapy, hand strength, and ischemia. Okay, so that can be tricky. You do want to make sure that you're using parentheses to set off any concepts that you're grouping that way. I do think the guide does a pretty good job of giving you an overview of that. So you can see anytime we're combining or we're putting 2 sets of words together, whereas if we're using and, we're specifying that anything that returns has to have both, right? So we get fewer things by specifying and we get more things by specifying or. So that kind of Boolean searching is one thing that I at least want to point you to as an option. It can be a little, excuse me, it can be a little tricky. The other thing I want to mention, we talked about phrase searching, but there's also an element called wildcard searching, which is a way of sort of hacking off a stem of a particular search term. And we're looking at occupational therapy up here, but we might, instead of, let's do this as a separate. So we got hand strength and all of our stroke questions. But for occupational therapy, we might have occupational therapists, we might have occupation-based interventions, and I can kind of capture all of them by just searching for a stem of an element and putting an asterisk on it. So that's going to return all these things, that use any variation of the word occupation, occupational, occupation-based. So I can really broaden my search that way. I think another way that can be useful is with particular specialties like geriatrics. You can get down to a stem and limit. You can kind of do that and combine it with gerontology or something like that. And now you're searching for any variation of those 2 stems. And so that truncation, I think, can be another useful way. Just to give you a view of what that looks like in terms of actual results, let's say we did occupational therapy. See what kind of results we get with that. 26,000. Let's go hand strength specifically so that we're getting somewhat specific here. And let's say I truncate that to just any variation on the stem of occupation. So we're going to go from 12,000, 13,000 up to 22. So if you're getting too few results, you can try doing some truncation of one of your keywords to capture different variations of that word, right? Nurse, nursing, nurses, all could be captured with NURS asterisk. So you can use that truncation or use that sort of root stem searching to broaden your search out a bit as well. That's my time. Those last couple, I think, are worth pursuing. Hemiplegia, was that a search you wanted to use? Oh, for the stroke and the hand thing. That makes sense. So yeah, you could cycle any combination of those in that way. I want to know what the wow was about. I'm assuming that was the different variation of results that we got. But if you want to,
I think it's really good for now.
What's that?
I got to learn a lot how to research.
Sorry, I'm having a hard time hearing you.
Okay.
Sounds like somebody's just kind of shy. All right, so again, I want to open it before I let you go. I am at my time here, but I do want to open it up one more time. If anybody has any additional questions or wants to do, maybe a practice search of their own, I'll make myself available for a few minutes for something like that. But other than that, you're free to go. I will submit an attendee list from this event for anybody who's interested in taking part in that raffle for the Amazon, the iLearn raffle for the Amazon cards. I'll also mention, this is always in my way, if you're interested in attending other events, you can find those through the library website under upcoming events. Click on that link, and I believe that'll take you to the full list of all of the library events, but you can also delve into additional iLearn events on the iLearn calendar. So hopefully you'll come out for some future events and really hone up your library skills. Very good. Thank you very much. I appreciate it. I'll let you guys go. I'm going to send out just a brief survey for you folks. I'll just use your names from the attendance list to do that. That's just a brief library survey that we do on some of these events. I think you also get one from iLearn. So if you would fill those out, I'm glad everyone, sounds like everybody learned something, and that makes me very glad. So you can also feel free to reach out to me specifically. I'll drop my email into the chat. If you have any questions, you can always email me directly if it's about our presentation, or you can always reach a librarian at the general library email. And I will let you guys go. Thanks for coming out. Thanks again.